Welcome back to another episode with Questions with Crocker with me, Dr. Crocker. I'm an emergency veterinarian, and my husband, Shane.
The not Dr. Crocker.
You're the Mr. Crocker.
Yes.
When people send us stuff, they should put Dr. and Mr. Crocker.
Actually, I would tell them that's my grandfather or my dad.
Mr. So you just want people to put Shane? Just Shane.
That's it.
That's it. So we are back from volleyball for the day. We've had an emotional roller coaster watching our kids play, and we are recording a podcast before I actually get on a plane going to Las Vegas for Western Veterinary Conference, and you actually get to come join me, which is really exciting.
On Monday morning.
I'm so sorry that you have 24 more hours.
It's my flight.
Of volleyball.
Which means I have to wake up like at 5 a.m.
I think you'll
Maybe
be okay.
Earlier.
But then you get to come hang out in Vegas with me, and I'm going to be working, and you're going to be...
Working.
Okay. We'll see. Who's more at the conference. Okay, so if you're new to Questions with Crocker, this is a podcast about our lives. I'm an emergency veterinarian. We also own a small animal general practice together where Shane is the CFO, helps me manage and run it. We talk about all things vet med related. We talk about our kids, our family, our life, and answer your questions. And we have a couple good questions today. But before we get into that, I just want to thank you because you helped me actually do a presentation for a school. St. George's University wanted me to do a VBMA talk, which is the Veterinary Business Medical Association. And so it's the business component and group that vet students can be a part of. And they wanted to talk on finances in a hospital. And let's just say that that's your swim lane. That's not my swim lane. So you helped me put together a really good talk on KPIs. How'd you feel like it went?
I think it went well. I prefer to do it in person.
Yes. Yeah. Zoom talks are always hard. And then sometimes you can actually see the audience and you can kind of get real-time interaction. This one, we couldn't see everybody. So we were basically
and we couldn't see ourselves. We're like talking to a blank screen, which is a little awkward.
It was really awkward. And then I like an interactive talk. So I threw questions out there, but it was a little weird because there was a big delay in people answering. So I do appreciate them making it work. And they said the turnout was good.
Good questions.
Yes. And I felt like the questions were like what we wanted to get across, we got across, and the information that we felt like was important. So we talked about kind of what you look at when you're looking at the profitability of a practice, what goes into that, and then what are the, I guess, industry standards around some of these things that we monitor. And if they're abnormal, like if your numbers are too high or too low, what do you look at in your hospital? Which I do feel like we're still learning.
Yeah.
So
sure.
I tried to make that clear. We've only been hospital owners a little over 2.5 years now. So definitely still learning and growing in our knowledge, but we do run other businesses. So hopefully some of that translates. So thanks for doing that with me.
What is that?
What? This?
Yes.
Oh, so this is actually cool. I just got it. So this is to record content in real time. So you like put it around your neck and then you put your phone here. So if you're doing like videos or if you're doing surgery, or the other day I went out and did an exam on a horse in the field. And so I was showing like where you take the heartbeat and where you listen to the gut sound. So you can like wear it and it's hands-free and you just attach your phone here and you can video.
Interesting.
You don't like it?
Makes sense now that you said what it is.
It does look weird, though.
Yes.
I can see where you were confused. If you want to see what we are talking about, actually, I should have said this earlier, you can watch us on YouTube. You can watch this entire episode. You can listen to us on Apple or Spotify. We would love it if you leave a review and give us some feedback on the podcast overall. And love it even more if you text during the episode and send us more questions. That button is supposed to be at the top of the Apple podcast I guess, feature when you're listening. And I've actually done that with some of the other podcasts I've listened to, so it's pretty cool. So we're about to head to Vegas, and while we're there, you are going to do a little bit of work because we're going to look at some of the booths there and some of the things that we're interested in. I was told that Antec has a new analyzer that can actually run an in-house cancer screen for pets, and it only takes about 5 minutes. And the machine apparently also runs cortisol and TSH. So really interested to look at that, look at the cost on that. But man, if we could catch some of these cancer things earlier, and especially in some of our senior pets, start to screen them a little bit easier, I think that'd be great, especially coming from an emergency vet perspective where I often see it that they're coming in with like an extreme, complication from cancer. So excited to check that out. And then also heard about a company that helps you with passing on credit card fees, which are just astronomical as a practice owner. So some people say if you feel like the credit card fees are really killing you in a practice, then just raise your prices to account for them. What are your thoughts on that versus passing the fees on to people, which I feel like I see everywhere now, just as a consumer out in the world?
Yeah, I was going to say historically, I would say just raise your prices. Nobody wants to be nickel and dimed over stuff like that. But now I think as a consumer, I'd prefer to have a choice, right? If I knew it was going to cost me 3% more, I may pay cash.
Some people say you have to take checks too, though. Which
is always a little scary.
It's very scary because I would say checks don't always go through when you go to deposit them. But I do think I kind of want to hear the spiel and hear what it's about. And that 3%, when you start looking at, especially as a growing practice, what that number is, it's a huge number. And so just interested to hear what they have to say about it. And I hear the way that they do it, it is a little state dependent. But as a practice owner, something that I want to look into. Back to talking about cancer and pets, had a case the other day at the GP, and it was a dog who had come in and actually had a wellness exam and did senior blood work, which is great. And on that blood work, the white blood cell count was up a little bit, and the dog had a little bit of a fever when it came in, so it was around 102.9. Pet's temperature actually runs higher than us, so really a pet that has a temp of 102, 102.5, I still would consider normal, especially if they're like an excited pet. So I don't know that 102.9 would have raised any, red flags for me if I'm looking at this pet. But the dog came back in and it had been only about 6 weeks and dramatic weight loss had occurred. They said basically this dog was eating and then would kind of throw back up what it had eaten. But it sounded to me more like it was regurgitating it back up. It was just like solid food coming right back up. And the temp when they came in was 104.5, which is a definite fever in pets. No other clinical signs, though. No coughing, no vomiting, diarrhea. Like that was true vomiting, bile. It was just the food regurgitating. So I recommended we recheck a couple things and start with x-rays because the white blood cell count being a little high before can sometimes mean there's infection somewhere, inflammation. And with the weight loss, and the age of this pet is most worried about cancer. So owners approved us taking x-rays. They're digital x-rays. So the team went to take the x-rays. I was doing other things. And then you get the dreaded, like, Dr. Crocker, can you come look at this? And you can kind of hear in everyone's voices, they see something. And so walked in, and unfortunately, in this dog's chest, there was just a huge, huge mass. And the trachea was actually, it should go kind of straight across the chest. It was diving down below this mass. And
so that's why I was throwing up?
Yeah, I'm worried the esophagus and the trachea run by each other. So my worry is that mass is pressing down on the esophagus. So when he's trying to swallow the food, and they say he eats like quick, she eats quickly. So, I think it's just going in and then just coming back out and not able to make it all the way to the stomach. And that's why we're losing weight and everything. So the great thing about digital x-rays is you can bring an owner in and kind of show them. And I was able to show, the lungs should be black because of air. There's this big round white thing here. It's pushing down on everything. It's a mass effect, most likely cancer with the fever. So we kind of talked about next steps, and unfortunately, I don't think I can fix this dog. I could send it for surgery. You can remove solitary lung masses, but with the age, they're just not really interested in the financial implications of that. So we did decide to do anti-inflammatories and antibiotics and just see if we could get him a little more comfortable. But I think the physical pushing down, I can't change that. So I did tell them, like, spend the weekend with your dog, but I would probably consider, quality of life sooner rather than later. Can you
shrink those, like, with
That's a question, like
radiation
or chemo? So that's an oncologist question. And I did offer referral to go, like, talk to a specialist about the options because as a general practitioner, I know a lot, but I don't know all the the greatest and latest things. So maybe I think
maybe just buys time.
Yeah.
Maybe not even a lot of time. I don't know.
And my understanding is a lot of times lung masses can be really slow growing. The other thing is with the fever, it could be an abscess or it could be something else. But again, that still would need like surgical intervention. I do think with the weight loss and the protein levels are high, I still think cancer is highest on the list. So owners elected to kind of take her home and put her on some meds and see. We did some canned food that was like easily digestible. I said feed small amounts frequently, see if she could keep that down because the weight loss is dramatic. But it was hard because it's kind of like your spidey sense is telling you this is cancer. And when I mentioned it to them, it hadn't really even crossed their mind. And then seeing the x-ray and it all coming together, I mean, it was like a teenage boy and a mom, and they just both started crying in the room. And so it really is a hard discussion to have, but I'm glad I could give them an answer. And then, ultimately advocate for the dog that we don't want her to just waste away. We want her to, live the best life she can. But a person at this point would probably get a feeding tube put in them. They'd be put on hospice. They'd get a morphine drug, and you just can't do that in animals. So it was a tough conversation, but at least we got them an answer, and now they can make decisions without wondering kind of like what is going on and what the options are. So that case was one that kind of stuck with me, and the owners were just the nicest, which is always like the nicest dogs and the nicest people that, crappy stuff happens to. So I wanted to just share that one. That's why we recommend diagnostics as veterinarians. And unfortunately, we don't always find something we can fix, but at least we're giving people an answer. So back to, now I feel like a downer Debbie. Sometimes that's how my job feels, is being a downer Debbie. So since this is Questions with Crocker and we answer questions, I recently got a couple questions in, and I thought you and I could kind of go through those together and see what you would tell these people and, what I would say. So at VetCads, CATZ, wanted to say they're graduating in 3 months. Congratulations. And feeling like they know nothing and they won't be ready at all to work. So what is your initial thing that you would want to say or give advice on? Did you ever feel like that?
I think everybody probably has that feeling once they first get out of school and you kind of start getting plugged into your career. You really never know enough. Mm-hmm. But I think you probably know more than you think you know. And you definitely know 85% more than the person you're sitting across from.
Yeah.
So I think we talked about this in an earlier podcast, kind of one of those imposter syndrome podcasts we did. But I think it's probably twofold. They probably have a lot to learn, and having a good mentor will be very beneficial. Mm-hmm. But the flip side is they probably know a whole lot. And once they kind of get the flow of, doing their job and getting in front of patients, it'll probably all
come together.
Yeah, kind of come together, and they'll have time to stop and go do research and ask questions and things like that.
Yeah, I mean, to me, one of the biggest things to think about if you're about to graduate is you don't have to know everything. And I don't know everything. And I've been out, 15 years. And so one of the best parts of this profession is we're always learning and we're always growing. I do think it would help you help you to feel more comfortable and confident if you were entering a practice or a place. Hi, Ranger. Oh, the lab tail is going crazy. Sorry. If you were entering like a practice or a place that was going to provide good mentorship and you really felt like, okay, I don't know everything, but I know I have support and I know I have resources. So maybe a conversation with whoever your future leadership is going to be about, hey, am I going to be allowed to have like a VIN membership where I can look stuff up easily? Am I always going to be on shift with someone initially? Like what are things going to look like? Maybe walk me through like my day. Because I feel like those things kind of help like calm your anxiety a little bit. And then I actually, in therapy, she's really helped me with when I start to get anxious or worried about things, is looking at like the reality of where I am. And it sounds weird, but if I'm starting to worry about something, she's like, but what is the reality? So the reality is you got into vet school. which is really hard to do and really competitive. So you're smart enough to be able to do that. And you are about to graduate vet school, which means even further, you've done well in school and you've passed all your classes. And they would not be graduating you if they didn't feel like you had a foundation to go out there and like be a good veterinarian. And I would say even further, the fact that you're even worried about knowing enough and doing a good job means you're a learner. And I do think that type of personality succeeds in our profession. I worry about the people that get out and feel like they already know everything.
Yeah, I was going to say that. Be cautiously confident, meaning go into the room with a lot of confidence because you do know a lot, but be cautious if you don't know 100% the answer to something. Be transparent. Like, it's a great question. Let me do a little research. I'll get back to you.
Yeah.
So,
and I do think that it's funny, especially working in an open concept DR where we do everything in front of owners and we train like new grad veterinarians. And some of the first things that they say is like, what do I do if I don't have the answer? I don't know. And I tell them, like, I am very honest with owners. And sometimes I'll say, I think that we're probably going to do A, B, and C, but let me just look up a couple things, make sure there's nothing new that's come out. Let me have someone else take a look at these x-rays with me, or I'm going to call Dr. Crocker over and we're going to look at this ultrasound together. I just want to make sure, and I think that pet owners appreciate the transparency and the fact that like more than one doctor.
Yeah, a team approach is much better than one individual.
Yeah.
So.
And if you're in a GP setting, it's very easy to say, hey, I'm going to borrow your pet for a second. Like I'll like tell the younger doctors, sometimes they could say like, I want a senior doctor to just take a look at these eyes real quick or, and just, or feel this belly. And I do think that people appreciate.
Yeah. Let me get a second look at this.
Mm-hmm. Yeah. So ask for support, make sure that you know what to expect, and then also kind of think about in your mind where you at and what is the reality of what you've already accomplished. You've already done a lot and you should be very proud of that and very like confident in that overall. But also, you're never going to know everything. So I just learned something new the other day and I was like, how have I been in this career this long? And I never realized that. And it was kind of like it's a humbling thing, but a good thing, I think, to just remember that you're never going to know it all. Okay. Another question that we got that I thought was interesting is at Insmo Obre said,
there's zero chance we got that right.
Yeah, I probably didn't, but I was trying to think if it said something interesting or like, anyways, said,
the last one I'm pretty sure was cats, CATZ.
Oh, it is vet cats?
Yeah.
Oh, man.
But I'm not looking at it. I'm just
You're
going
very
off
smart.
the gut.
Usually I'm the linguistical person. You're the numbers person.
I need to change roles based off of this.
Based off this podcast right now. You now can help our kids with their English homework instead of me.
I'm out.
Okay, so they said, I'm on a job where I don't learn. It's they said old-fashioned in parentheses. So I'm thinking like a hospital that does things more old-fashioned. But it has really nice pay and nice hours. So can you really have it all? And I thought this was a really great question because I get what they're saying. Like they're happy with a large portion of, their job. And a lot of people gripe about their hours and their pay in our profession. So they're already kind of ahead of the game. But if they're out of practice or they don't feel challenged and they don't feel like they're learning and growing, can you really have it all? So what would be?
I think you learn and grow sometimes independently of where you're at, meaning you have a lot of opportunity to go to CE and do research and things on your own. So just because you're in the four walls of your hospital doesn't mean it could,
you can't learn and grow.
Yeah, you can't learn anymore. Does that make sense?
It does make sense, but I could see where someone would say, yeah, but like if I go and do this, but they won't get the equipment I need to do the procedure, or, they won't let me do this procedure at the hospital. Like they send everything to specialty, or where I live, people won't actually do any advanced procedures or diagnostics or whatever. Then it does make it tricky, especially if your clientele has been trained in a certain way.
It's more like training to the clientele.
Yeah. But I will say that the ability to grow and learn in our profession, I do think makes it more sustainable. And having good pay and hours is great. And really, it comes down to your personality. I mean, some people, that's all they need. Like it's a job. They show up, they do their job, they get paid well, they get to go home, and their priority is all the other things they're doing outside of the practice. They want to be able to, spend time with their family, their friends. They fill their cup in other ways. And they're probably perfectly fine, like not advancing their knowledge or their skills and just doing the job that's in front of them.
But the answer is you can have it all.
Yes.
You just have to sometimes get uncomfortable to get comfortable.
Yeah. So either it might be you have to find a place that still has good pay and good hours, but also allows you to train and learn and grow. Or in this practice specifically, you have to kind of push your leadership team a little bit that it's a good investment for you to do more things, or, that for your clients overall in the long run, it's going to help them and their pets more.
Now, I got to think most business owners want that type of employee, right?
Yeah.
Somebody that comes to them and says, hey, look, I've done a little bit of research. We can buy this piece of equipment. It costs X, but I've looked at the numbers and we can charge Y, and it'll probably cover itself in the next 2 years. Yeah. What do you think? Right?
Yeah. So. I mean, as a business owner, if I have someone that is doing the research to find a new diagnostic modality or procedure or avenue and revenue stream for our practice, I am all about that. And those type of employees that are invested in the practice and themselves, to me, are the cream of the crop. The fact that you want to learn and you want to grow. I do think sometimes having good hours and good pay is because you're at a practice that is just kind of status quo and needs somebody. And so you get paid more and they're really catering to your hours. But I would say, and I would hope people that work in our practice would say, that we have good hours and good pay, and they're still very much encouraged to keep learning. I just did a feline extraction workshop that I paid for, and me and one of the associate vets did that together at Southwest Vet. We definitely encourage everyone to get their CE. We do a lot of lunch and learns. I really want someone on my team to do ultrasound training so that they can start to do full abdominal ultrasound. So I think that we really encourage that type of culture.
And also for the owners out there, don't be complacent with your team. Recognize if you have somebody that is looking to grow and expand the product base and knowledge and, has good ideas, embrace that. Don't just shut it down because you've always done this. Right?
Well, and this is a great example of, honestly, if you think that just paying people and giving them
it's not enough.
Good hours is, it's not enough. Yeah. People want to be challenged and they want to grow, and you're going to lose really great employees if you can't find a way to foster that. And it's the same with support team members. I mean, one of the main things with the burnout studies that AVMA has done is that techs saying, I don't feel like I'm used to the full capability of my license. I feel like, I'm stuck. I feel like I don't have any room for growth. I feel like I don't have any leadership track that's available to me. And so you have to recognize that, especially in these employees that are really great, you're not going to keep them if you can't keep them challenged.
And definitely, it's a team effort. We say that as business owners, we want to do that, but sometimes we get stuck in the everyday challenges of life, and you may overlook that stuff, but it takes the team, right? It takes you being open to that, but it also takes team members bringing you ideas and not just being complacent as well. So if you have both teams working together, a lot of times you can probably solve a lot of these issues that may not even be coming to a head.
I do think for this person specifically, one thing I would say is that if you really like where you are, and if, moving practices isn't an easy option, what I would say is set a goal and tell your leadership team, I want to meet and I want to talk about where I want to grow. I want to bring to them a training or a program. I want them to, invest in me and have a certain amount of time that's going to happen in. So kind of give them a chance.
That's what I'm saying.
Right?
Yeah.
Because maybe
open up that dialogue.
Yeah. But if you do all that and you have a structured, discussion and they are just not interested, then that would be a red flag. And I don't think long-term you're going to be happy there. And I do think that there's practices out there that are absolutely going to be able to tick all your boxes. The only thing is you might have to make a big change.
Yes. And some of it may depend on location, right? If you have family and it's a small town, you may be limited, right?
Yeah. And then, some people will say, which just kind of frustrates me. Online, someone will kind of gripe and people are like, well, open your own practice. But I'm like, that's not
always the answer.
No, that's not always the answer. And that's not always easy. Now, I think you have to recognize if you're not the owner, and you're not willing to open your own practice, then you either have to like fit your peg into the board that you're a part of, or you do have to do something different. So you either make it work for you or you don't. But I don't think that's, it kind of negates their feelings and the understanding that as business owners and practice owners, we need to listen to our team, and we also need to be willing to like make it work for them. And just saying like, well, go find something that works for you. I don't feel like that's a great leadership attribute overall. Okay. Last question. I thought this one was interesting. So at McKinsey.lm said, why do people assume that veterinarians can't make a comfortable living?
Do people really assume that, though?
100%. 120,000%. I mean, it is shocking how people will online or in person even like make comments saying basically that them taking basic care of their pet is somehow us making loads of money and taking advantage of them.
But do these people still gripe to plumbers and electricians and other people as well?
Potentially. I don't know. I don't know how much they see plumbers and electricians to gripe to them versus like, seeing your veterinarian more regularly if you have a pet. But I do think that there's so much that has changed about why veterinarian medicine is more expensive than it used to be. There's a lot of factors that go into that. We're paying more, school costs more, inventory costs more, real estate costs more, the world costs more, and
the level of medicine has increased.
The level of medicine, yes, technology, how long pets are living, the ability for us to care for these pets with preventative care and emergency services.
How much people actually care for the pets.
Oh my gosh, like people seeing them as family. So there's a lot that goes into why things cost more. The funny thing is like, for some reason, the fact that things cost more, and if you run your business well and then make a profit, that is seen as a negative. That is seen as you are only able to make a profit and make money as a veterinarian if you're taking advantage of pet owners.
The question really is, I never thought about this before, but has the percent of revenue derived from a veterinarian really increased? Meaning, if one vet 30 years ago was still making 20% of the revenue, they're still making 20% of the revenue today. They just derive more income. Like, I wonder if the actual percentage of what veterinarians made as a percent of revenue has actually increased or has actually been flattened.
My understanding is because you now have more people getting like their pharmacy stuff online, and you have more money that's like gotten outside of your hospital for pet care, that it is harder to make a profit as a business owner. And you're paying your support team more, and you're paying for real estate more. And
you're having to charge for your knowledge.
Yes.
Historically, they didn't always charge for their knowledge.
Right.
But that's what I'm saying. So like if a practice did $500,000 a year and they took 20% production and 10% of the bottom line for just, EBITDA dollars, they made 30%. Say, call that 30 years ago. They're still making the same 30% today, right? It's just the buckets have changed of how they're bringing that revenue in. It's not being derived from pet food and medicine anymore. It's, the knowledge base that they've gone to school for and everything else.
And I do think it gets messy because I do think people lump together like private practice owners and corporate practices. And there is a discrepancy sometimes in what each is charging and how they're charging. And the crazy thing is like corporate practices get their inventory for much less. Like they do some things and that are costing them much less money, but they have so much more overhead. And then they also have, the backing of private equity that's putting money in so they can work at a loss sometimes and some other things.
Well, they also want a return on their investment at some point as well.
Yes. But, to be completely honest, I am hyper aware of this, especially as a business owner in like a smaller town, and who's also on social media. So like you and I, we just put a pool in to our house, which is not a cheap thing. And we have a nice house and we have a nice lifestyle. Now, we also own multiple businesses and have worked really hard. But I would say that I have not like posted about the fact that I'm putting a pool in and doing these things, or that I drive a nice vehicle, because the perception would be that I am overcharging pet owners. In some people's minds, I'm overcharging, and that is how we are able to live the life we live. Not accounting for the fact that, there's other things and many things that have gone into that. It's just frustrating. It's frustrating that I have to worry about talking about something because the judgment is out there.
I think everybody earns the right to make as much money as they need to make based on the hard work and knowledge that they've built, whether that be a preacher or a doctor or a dentist or a veterinarian or a plumber or electrician or whatever it is. People have the right to be able to charge and make money. Economics works in a certain way, meaning if it becomes too expensive, you don't do it.
Mm-hmm.
If our toilet backs up and a plumber tells me it's going to be $5,000 to fix it and I can't afford it, then I'm going to go fix the toilet myself, YouTube it and find a way to do it.
Or find a cheaper plumber.
Exactly. So economics kind of takes care of overcharging. If people, ask the right questions and shop around. But to say a veterinarian can't make money or taking advantage of me because my pet's sick is just not
is wild.
Yeah.
Yeah. I think the thing is like cause and effect, right? The fact that a veterinarian makes a good living or maybe owns multiple businesses or practices and makes a good living does not equate to my pet got, I had to spend more money so they could do that. Like it makes me insane that someone would think I'm just going to jack my prices up because I want to put a pool in my backyard. Does that make sense? And I do think there's some people that feel that way. And it's crazy to me because I think we have people that are not going into this profession that would be great at this profession because they do want to make a good living and they feel like they can't do it in this profession.
I mean, you can make a lot more money. You can make a lot more money being a human doctor.
True.
Or a dentist.
True.
That's just the reality of life.
Of life. I know. But I do agree that people feel that way, and they feel that way because of social media and the stories that are out there of people saying I was taken advantage of, or I found this stray animal and it was dying and I took it to this place and they wouldn't do everything for free and they don't care about animals. And they, I think that is why some of that has shifted, which is also why there's a large amount of us on social media sharing who we are and sharing the reality.
I mean, there's probably an 80-20 rule there. I mean, 80% of veterinarians are probably good people and are doing the right thing and want to make enough money to put a roof over their head and feed their family. Mm-hmm. And there's 20% that are greedy and doing shady stuff, just like with cops and firemen and everybody else,
Yeah, like any industry. And I'm not going to lie and say there's not veterinarians or, corporations that probably charge more than they have to because they're trying to just make a profit. But I also am not going to say that the hard work that I'm doing as a private practice owner or as an emergency veterinarian when I'm working holidays and weekends and nights that I don't deserve to be compensated well for that because I've put the work in for it. So I think that there's a big issue with the storytelling about why we do what we do and,
Should the industry, veterinary associations do a better job in marketing or advertising or getting that word out to pet owners?
I would say for the past 3 years, I've been trying to talk to our national, American Vet Medical Association, the local one. I mean, I'm on the PR committee for the Texas one. And I've been trying to talk about these things, about how we need to be humanizing who we are in veterinary medicine, how much we care, the hard work that we're doing, but also why things have changed so much over the, past 10, 20, 30 years in veterinary medicine and really try to get that out there. We are just slow to market ourselves basically as a veterinary industry. I think some people still see it as a weird thing or a strange thing for us to do that. And so it's been very hard to move the ball in any direction. But anytime I post something talking about how hard we're working or telling a story or talking about how we did help somebody with financial needs and the ways that we're trying to do that, people are like, oh my gosh, I didn't realize that. And I'm going to thank my veterinarian. And I didn't realize how stressful this was on you guys. So it does make a difference, which is why I really encourage people in our profession to put their stories out there and share who they are. But you're going to always have, like you said, a small amount of people that are going to either give a pet owner a bad experience, which in turn is going to make them blast us somewhere, or you're just going to have people you're never going to get to understand that we are not over here, especially as private practice owners, like rolling in the dough. And even if we are making a good living, we work hard. Like, I don't know what else to say. Like, I feel like, here's my friend, I feel like I have to defend
justify your job
and justify.
Yeah, that's the part,
and that's
crazy
the frustration.
To me.
Yeah. And I don't know how to get out of my head about it, because I literally I can't talk to people sometimes about it because I feel like I have to explain all the things I've done and the way I try to help and the way I give discounts for this and the way and it's like, I shouldn't have to do that. I should be able to say, I'm a veterinarian, I work hard, I help the pets, I charge appropriately. And yes, I make a good living, but I do a shit ton of other things that also make me money. You do a ton of things that make us money. And I shouldn't have to justify it. So I don't know. I don't have the answers.
We need to make more money. That's what we need.
The finance guy over here is like, all right, I need you seeing more pets. So I do think that is a hard thing. And I think for younger veterinarians, it's a really hard thing to deal with. And as me being so far out, but still struggling with it.
A young vet shouldn't have to struggle with, again, we've talked about this in the past, veterinarians going to vet med because they have a passion for it.
Mm-hmm.
They're smart enough to do whatever they wanted to do.
Mm-hmm.
They choose vet med because they're passionate about helping pets and pet owners. They should be well compensated, and they shouldn't have to justify their compensation.
And we're still not as well compensated as other
many
other professions that work as hard as we do.
When you look at how hard it is to get into the school to begin with, and how hard you have to work to qualify to get into school, and then how hard school is, and how difficult of a job it is, veterinarians are severely undercompensated for the work they do.
Well, that's why I love you and appreciate you seeing that you live with it. So, but those are some of the messages we're trying to get out. So I thought that was a great question. I'm glad we were able to address it. And that is going to end our episode today. We hit on a couple good questions. We need more of them. So you can go to any of our social media accounts at Questions with Crocker, and you can leave your questions. You can watch us on YouTube. You can listen to us on Apple or Spotify. And please, please, please leave a review. I've heard of people having challenges, like if we get to so many reviews, we do something silly. I can't really think of anything I can make you.
Do we have reviews?
We do have reviews. You never look at our reviews?
No. I have zero. I have
no
idea how to do that.
You're the worst co-host. Do you even listen to our episodes after we finish? Don't even answer that. Don't answer that. All right. Thank you so much for listening, and have a wonderful day. And leave a review if you get a chance. Thanks.